So how do we manage these patients, right? So we have somebody who's in cardiogenic shock, they're hypotensive, maybe they're altered, maybe they're tachycardic, they have signs of end organ perfusion, they're not doing well. How do we manage them, right? Well, first step is listening to their lung sounds, right? And go back to the previous video for the differences between wet and dry cardiogenic shock, right? That's a key step here, is listening to their lung sounds and determining if there's fluid present. If there's fluid present and they got those cold extremities and we're going down the route of wet and cold cardiogenic shock, then we really need to be looking more towards inotropic style agents. So things like low-dose epi would be the most common one in EMS. And then if shock persists, looking more towards adding on something like norepinephrine. If their lungs are clear and they don't have any signs of congestion or fluid buildup, but they still have cold extremities, they're hypotensive, they have signs of, cardiogenic shock elsewhere, maybe like diagnostic of an MI on a 12 lead, for example, then we can start looking at maybe doing controlled fluid resuscitation and giving a small fluid bolus to help. Now, there's a caveat to when giving fluids in cardiogenic shock patients, right? Their heart is very sick. Okay, we don't want to give too much fluid to the point of where we just add extra stress onto the system. So we can give a small fluid bolus, see if it helps improve, and then if it doesn't, or we start getting signs of edema building up in the lungs, we have to stop those fluids. We can't give more, and then we got to start looking more towards adding on pressors, so things like norepinephrine again.
We love that you love our videos, so much so that we've actually created some shock illustrated notes for you, and you can download these for free in a link on our bio.